Let's do it.
All right. So, is it started?
Yeah.
All right. You respond to a 66-year-old male who is unresponsive.
Cool. All right, so 66-year-old male, unresponsive. So we're gonna go skirt on out there. Do we get any updates while we're en route?
No.
Yeah, is it a pretty long drive out there?
No.
Okay.
5 minutes.
Cool. So we show up on scene. What are we looking at? Like,
So you walk in. There's a bed just chilling right there in the living room.
Is it on the floor or is it on something?
It's on something.
Okay.
Fancy. Yeah. And he is unresponsive, laying in bed, peed himself.
Cool.
Diabetic, pale.
Okay.
Yeah.
So I'm gonna do like a little responsiveness level check. So like I'm talking to him. Any response?
Nothing.
Pain. So like sternal rub, trap pinch.
Nothing.
Nothing. So he's unresponsive.
He is unresponsive.
So I'm going to feel for a pulse. I'm going to. Is he breathing?
Yes.
Very adequately shallow. Pretty fast or pretty slow or just kind of meh?
Just kind of meh.
Just kind of meh. Does my pulse feel like decent?
Yeah.
Okay. So I'm going to. Is there like a wife or a spouse or something?
His son is there.
The son's there.
And he's like, yeah, he just started acting a little weird and called you guys.
Okay.
They went unresponsive.
Cool. So we're gonna get full set of vitals. So like I want my SpO2, I want blood pressure, I want a 4 lead, sugar,
Okay.
all that jazz. And while
Tell me
he's
them in
doing
order and I'll
that,
give them to you.
we'll go. Well, I usually do SpO2 and blood pressure first.
Got SpO2. We'll say 93.
93%.
Sure.
Okay. What's the heart rate on it?
Heart rate 101. What else?
Pressure.
120 over 80.
Okay. My 4 leads on there.
Sinus rhythm.
Sinus rhythm and I got a Shuggies as well.
Reads low.
Reads low. Sweet. Okay, so I'm gonna ask the son, does your dad have a history of diabetes?
He does.
He does. Okay, has this something like this happened before? And we're gonna begin an IV set.
Something like this has never happened before.
Okay. So I'm gonna start working on my IV. You said he was at 93%?
Yeah.
Okay. So we're gonna get an IV going. I'm gonna have my partner spike a bag of D10.
Okay.
And so once we get the IV, we can start hanging that. Hopefully this helps him come back. We're gonna be. I'm gonna throw him on a nasal cannula as well because he was breathing kind of shallow and he's at like the low end of it. So maybe like a liter. Just kind of see if we can perk him up a little bit that way too.
Okay, it does.
So we got the sugar going in. We can reassess that. Does he start to get more responsive as all this happens?
I mean, how long have you been doing this for?
The sugar?
Like, yeah.
It's getting in there.
You seem to start kind of making a little bit of movement.
Okay. Sounds good. So while we're doing that, while that's continuing to run, I'm going to get a 12 lead on him too, just to rule that out. Because he was sweaty and stuff and pale. And so I just would like to rule out any cardiac elements. So that's good. And so we'll keep going. I'm going to be talking to the son if we have like a history of other medical conditions.
He's had a stroke before.
He's had a stroke before? Okay. And so, are there any like medications that he takes?
Yeah, he does, but I don't remember what they are.
Sounds good. So as that's going on, we're going to keep reassessing our patient as he kind of hopefully comes back a little bit more.
All of a sudden he perks up. He's like, what just happened?
Mm-hmm. So we'll talk to him. We can explain to him that it looks like he had a low blood sugar episode because of his history of a stroke and the lack of consciousness and sudden onset of it as well. I'm going to do a stroke assessment on him, so have him smile, check for arm drift, all that jazz.
He passes the...
How was the fire out there?
Okay, and so he passes that. I'm going to retake my sugar.
Okay.
What are we reading at now?
130.
130? That's cool.
Oh,
And so I'm going to ask him, be like, hey, so I'd like to take it to the hospital. Are you okay with that?
Nope.
No? Okay.
Need to wash their
So what,
That's something like
fine.
so what was
Okay.
the fire?
So I'm
the
going
fire
to
alarm went off
continue
again?
to try to encourage him
It's just
And if he
they
is
haven't
continuing
been
to be
able
adamant not to want to go,
effectively reset the
then
system and
I
the
will say,
alarm
look, I would
they
like
thought
you
that
to
they
go
had.
get some
but
real
it's the
food in you really
tamper
quick
on the
before I
resin.
leave. Just
This is
because
like
I don't
flowing
want you to
water,
burn
like,
through the
it
sugar
sits
really
there
fast,
all
Yeah,
the
and I don't want
time,
you to conquer
and then you
it.
start
Not me.
flowing.
Sure.
Something might just break
So
free.
go get him his peanut butter jelly sandwich or something like that.
Grab
And
that
then-
switch again.
Once again, encouraged to go. Does he still refuse?
Still refuses.
Thank you,
Still
Chief.
refuses. Then,
Thank you.
given the fact that this is a medical condition that can continually happen, and he's aware of it, and we got him lifted up to A&O times 4 kind of mindset, and he is, what's the word I'm looking for? Pretty kosher at the moment. He's got some more stuff going on to prolong him. We can get a refusal if he's kosher with that. So we can
Refusal
get that.
received.
Okay, so we can get that, and then we can clear it and return back to service. And remind them that if something ever happens again, feel free to call.
Cool.
Good job.